Hi, welcome back to the Chiropractic Patient Education Training. And again, this is the training that's the major things. Number one, can increase your business over $100,000 in 90 days. Number two is it'll get actually insurance companies, third-party payers to pay you. And it stops insurance fraud. And actually, it's very easy for the patient to accept and understand it because, again, this is not based on a profession trying to sell the profession. This is based on the patient's natural motives. In other words, our patient education is totally based on the three phases of healing, which is science. It's not a philosophy. That is what happens irregardless of where the patient goes. And the patient's test. That's what it's based on. It's very easy for them to understand that. And so that's how it works. But let me just walk you through what a typical patient experience would be like. And before I do that, let's just remind you, we're dealing with a lot of concepts here and market forces. So number one, we have to understand motivation. And so I talked real extensively about what's called pleasure, logic, fear. In other words, what's the number one thing that the patients typically, what chiropractic patients want? The common symptoms are pain, muscle spasms, decreased mobility, and they want to get their primary ADLs back to normal, where they don't have pain and restrictions with what are important in their life. And the reason, so that's the pleasure, and the logic is the therapy that's going to get them there, and that's explained in great detail. And then, of course, the pleasure, logic, fear. The fear is if they heal wrong, then that's what can cause a permanent problem to some degree. So that is what's important in motivation. The 4 steps to the purchase. We pay a lot of attention to the natural purchase cycle of a human being, which is the need analysis, presentations, obstacles, close, in that order. If you mess that order up, that'll create a defensive reaction. The 4 most important questions have to be answered in order. What is my problem? Can I help? How long is it going to take to feel better? What is it going to cost? All of these are integrated into the patient education. We talked about the importance of stair-stepping, giving a little bit of information at a time so they're not overwhelmed. We talked about third-party trust. The most important factor is the pain motivation tied to third-party trust, which is the 3 phases of healing in the patient's test. In other words, they have to see that their care is totally based on these tests, not just their symptoms alone. And that is very, very important. We talk about the formula, need versus time and money, that as we're communicating, the perceived need gets established, and as the need gets established, the time and money get minimized, and that's what makes it all work. And we talked about the multiple contacts, the importance of multiple contacts, and when you can introduce some topics and when you definitely don't. So as an example, we'll just walk you through. And again, our care is based on the 3 phases of healing: inflammation, repair, and a remodel phase. So as an example, patient comes in, we'll do the consultation. We'll pay a lot of attention, not just to their symptoms, but to their ADLs. We'll do the physical examination to get all the biomarkers. So we and they have a total understanding of the need and the problem. We'll also cover that, if we can help them, we can. We'll take the x-rays as necessary. We'll do some therapy typically to help start decreasing the pain and inflammation. And then we'll educate them. Their care is based on 3 phases of healing. And on that particular day, we're only going to talk about inflammation. Then we only ask for time and money the next day. So it's not a lot. So it's called present time consciousness. Remember, the relationship's very fragile right now. What you say and can't say is very important. And then day 2, they come in, we just confirm the problem. And then, yes, we can help. And then we go into, we ask for 3 days, if we can work with them for 3 days to see how they respond to treatment. And then we'll have a better idea of how they'll get back to normal. So we're just going to ask for, when it comes to time, we're only asking for 3 days and 3 payments. So it's very easy. We're not asking for a whole lot. Remember, because it's still a pretty fragile relationship as we're building the value. So that's what happens on day 2. Day 3, We continue with the patient education, so time and money has already been settled. Day 3, we can go into the remodel phase of healing with the patient education. Day 2, we did the repair phase. Day 3, we did the remodel phase. At the same time in day 2, we're covering half the tests. Day 3, we'll cover the patient education for the remodel phase. We'll cover the other half of the test, to make it simple. So now the patient totally understands at the end of day 3 that their care is not just based on symptoms. It's based on about 8 to 10 very specific tests. It's based on each of the 3 phases of healing, that there's a totally different therapeutic goal for each phase of the healing. As an example, they understand the therapeutic goal in the inflammation phase is to decrease pain and inflammation and muscle spasms. They'll understand the goal of the therapy in the repair phase, based on what happens physiologically in the repair phase, is to increase active, passive, and joint motion. And then in the remodel phase, they'll understand how the goal of the therapy is to increase strength and elasticity. And all of this is totally based on the science of the 3 phases of healing and the patient's positive test findings. That's why we do the therapy we do, and that's how they understand how we can get them out of pain, muscle spasms, increase their mobility, get them back to where they can do their ADLs that are important to them, whether it's work, sleep, bathing, showering, getting dressed. So now they understand how we can get them back there. That's called logic. And now they also understand the fear part. They understand that when the body heals wrong, that's what causes permanent problems to some degree. And so now they totally understand the pleasure, logic, fear, exactly what's involved and what determines how well they're doing, which is all their tests. And one of those tests includes symptoms. That's not the only test. So it totally shifts their mentality to just feeling better to, wait a minute, all of these tests are important, not just this one. And which phase of healing are they in? And they know the consequences. So they understand why we're doing therapies at each particular phase, but most important from a motivational standpoint, they know the consequences if they either don't get that therapy or if they heal wrong. And that's the highest motivation there is to have a permanent problem to some degree the rest of their life. So, because that's what does happen when we heal wrong. As a matter of fact, remember, that's the number one cause of the number one disability in the United States is osteoarthritis. The number one cause of osteoarthritis is major and minor trauma that heals wrong, alters joint movement. That joint movement creates abnormal wear and tear, degenerative changes, muscle spasms, pain, discomfort, restrictions. That's exactly what happens. So it's the truth. We just explain the truth relative to where they're at. And obviously the goal of the therapy is to totally get them all of those factors back to normal, or as much as their body will allow, and decrease the likelihood of a permanent problem. So that's the education for day 1, 2, and 3. And remember I said every day there's a little bit of administrative, there's a little bit of clinical, and there's a little bit of education. So come day 4, where are they at now? They're in a total different position to understand reported findings relative to day 1 or 2. So what's happened up to this point? Well, the perceived need is sky high. They understand their problem relative to how it heals. Where's the trust? Well, it's way high. I mean, just from multiple contacts, trust and confidence goes up, defenses and resistance goes down. So the need's there, the trust is there, and they understand how they're going to get better. They understand the pleasure, the logic, and the fear. They got the whole picture. That's the need. Now, the only thing I have to do is deal with time and money. So time, we made sure that they were able to get in and out of the office, and, they didn't have to wait long periods, so they experienced effective, efficient time. Then we take the money, and we'll calculate the number of visits based on how many they need in the repair or the remodel phase. It's all science-based. So there's a certain time frame and window for treatments in the repair phase and what therapeutic protocol you use. And there's a time frame in the repair phase and what therapeutic protocol you use. The two most important variables are their age and how long they've had the problem. What determines the care is their biomarkers, the frequency and the type of care you get relative to the 3 phases of healing. That's what determines the frequency of care, the type of care, and all of that's quantified with the re-exams. And now the patient knows. It's the re-exams that are going to determine how well they are, not how they feel, because how they feel comes and goes, and it can come back, and it definitely will come back if they heal wrong. They understand all this now. They understand that everything about their health care are those tests and the 3 phases of healing of what we're trying to do physiologically. Because we simplify it, we make it real, we dumb it down, we make it really easy to understand, and it's about the patient. So by the time they get to day 4, there's huge trust, huge need. They understand the consequences. They understand how we're going to take them to where they want them to go. They're already feeling the results to some degree. Most patients are definitely feeling better to some degree by the 4th visit. And now we don't introduce anything new. Now we just go remind them. Our report of findings is unbelievably easy. We just remind them of what we just taught them the previous 3 days. Here's the 3 phases of healing. Here's your test. This is what happens at each of the 3 phases. Essentially, usually by that time when we ask the patients how long of care, what type of care do they want, inflammation, repair, remodel. I mean, everybody says, well, yeah, I'd like to get back to normal. Nobody says, yeah, I want a permanent problem. So then we'll just add up the visits in each of the phases, the repair and remodel phase, and then multiply that times the cost per visit. And then we'll take that cost per visit, because now the money could be higher, it could be $1,000, $2,000, or $3,000, depending on your cost per visit and what you're doing. But what's important is that you go to terms, because there's 6 socioeconomic classes. 5 of them can afford care, but only 2 of the 6 economic classes can afford to cut you a check for $1,000, $2,000, or $3,000. So if you want all 5 of the 6 socioeconomic classes to afford chiropractic care, you just go to terms. So all I'm going to do is take the money, and this is really how simple it gets, is their perceived need has to be higher than the perceived money. So if their perceived need is, let's say on a scale of 1 to 10 is a 6 or 7, and their perceived idea of money, how much you're going to charge them, let's say it's $1,000, $2,000, or $3,000 for their care. If it's greater than 6 or 7, that'll stop it. They won't move forward. But if we take that $2,000 and we drop it down to where it's, $97 every 2 weeks or something, it could vary again. These all vary. But the bottom line is the 2-week payment is very easy to handle versus cutting a check for $2,000. See, that's very easy. That's what makes it work. They totally understand the care, what it's based on, how they're going to get from point A to point B, and most importantly, if they don't, the negative consequences. Now I have to deal with the obstacles, trust, time, and money. Trust is already there 4 visits later, unless you did something weird or did a paradigm shift, which you don't want to do, because that violates trust. And then the time experience they should have experienced in those 4 visits, where they didn't have to come and wait for 20 minutes in your waiting room, and you efficiently treated them and got them in and got them out, So now you're just dealing with money, and it's real easy to bring that money down and to go into terms. There's multiple ways of doing it, but it's real easy to take that money down into terms. And there you have it. This is when 70 to 80% of the people say, yeah, that makes sense. I can afford that, and everything you said makes sense. I don't want a permanent problem. I want to get back to normal, and everything you said makes sense. That's when they say, yeah, sign me up. And you'll just start keeping people left and right. They won't start bailing out after 5, 6, 7, 8 visits. And boom. Well, how much does it take to increase your business $100,000 a year? just from patient visits. Well, if you take $100,000 a year, divide it into $50, let's say a dollar per visit is 50. Could be higher, could be a little lower, but 50 is a pretty good number across the nation. So let's say it's 50. So divide 50 into 52 weeks for $100,000. It's 38 visits a week. You only increase your practice 38 visits a week, and you increased your profit $100,000. And by the way, it's 97% profit because you're already paying the fixed expenses, rent, labor. They're already being paid. So this is literally a 97% profit when you make that extra $100,000, and you didn't have to pay for it. Now, you did have to have skill. You did have to be a better communicator. You had to have more knowledge. That is a fact. But you didn't have to pay for it like advertising. And then they stay. And the great news about that is you have even a better chance of getting referrals from them if they stay as patients as opposed to if they leave. So that's how you can easily increase your practice $100,000 a year, is by keeping more of your patients up to 38 or more. And that's pretty common. We have over 90% of our doctors that routinely increase their practice over $100,000 within 90 days of applying this system, because how understandable it is and how affordable it is. And that's what happens. And the patients, one of the common responses I typically hear from the patients is man, that makes a lot of sense. And a lot of times they'll say, how come my doctor didn't tell me that? Well, that's the way it goes. Of course, that's good news for us. But that's exactly, these are major concepts. And so let me just share with you the offer. We have our chiropractic patient education system. And let me just share with you what it involves. It involves, first of all, the education, the basics of the 3 phases of healing, the basics of the biomarkers and the test we're talking about. You don't have to buy any other machines or nothing like that. It includes all the scripts, and some areas it's very important to have scripts. Like when you give a diagnosis, I mean, it's real important to have a script to do that. When you talk time or money, it's real important to have a script so you don't get confused. And so some areas are really important to have a script, especially when you're explaining the 3 phases of healing, to really dumb it down and get it across and simplify it without talking for 30 minutes. So it includes the pre-recorded videos, it records the scripts, and then it includes 6 months of training. And here's what that means is when you buy the package, it includes 6 months of training. And what I do is I have you record your patient education sessions. And then I have you email them to me. Usually it's about once a week. We'll do a live webinar. I'll have you email them to me and we'll listen, and I will review what you're doing right and what you're doing wrong, and so you can see the things you're doing wrong and right real fast. In other words, we'll make corrections real fast. It's all covered. It's all based on the patient. It's totally HIPAA compliant, because that's what I'm doing, is I'm helping to increase your communication skill level and effectiveness as a doctor. That's exactly what we're doing. So it includes the pre-recorded videos of the education. It includes the scripts, and then it includes 6 months of live training. So you can see, you go, well, how valuable is this? Well, typically this, if you can increase your business 100,000, 38 visits or $100,000 a year, that's a pretty good return on investment. So the price is typically $19.97, but with this particular offer, we're going to go ahead and offer it to you for $9.97. So it's $9.97 to increase your practice the rest of your life over $100,000 a year. Very specific, includes the videos, the scripting, one-on-one training with me. Go ahead and just make the purchase. As soon as you make the purchase, then I'll do an orientation with you, go through the basics so you kind of have a big picture of how simple this is. We'll get the videos over to you, we'll get the scripts over to you, and then we'll talk with you. You can jump right into the training, either for yourself, but you can also listen how I train other people, so you can learn through me training other doctors, okay? And all of that's live, and as well as pre-recorded. So that's what's involved. You can increase your business $100,000 a year the rest of your life for only $997. Includes the pre-recorded videos. It includes the live workshops that we do, the live workshops. It includes the live training, and then it includes the scripts, all of it, for only $997. Increase your business over $100,000 a year the rest of your life. So just go ahead and make the purchase, and then immediately we'll turn it around and get you the material, get you the videos, get you the scripts, get you into the training. Looking forward to working with you and increasing your practice and your business.